Welcome to This Week in Obstetrics and Gynecology. This week we're covering 10 notable papers spanning urogynecology, surgical management and oncology, and reproductive endocrinology and maternal health. Let's dive in. Starting with urogynecology and pelvic floor disorders, 2 trials explore the management of recurrent urinary tract infections and long-term anatomical changes. In the TAPER trial, researchers evaluated whether periurethral application of estradiol cream is non-inferior to intravaginal application for preventing recurrent urinary tract infections in postmenopausal individuals. Among 114 randomized participants, periurethral application achieved a similar proportion of urinary tract infection-free participants at 6 months compared with intravaginal application, with roughly half of participants in both groups remaining infection-free. However, participants using intravaginal estrogen experienced vaginal itching at a significantly higher rate than those using the periurethral approach. For clinicians, periurethral application offers a viable, better-tolerated alternative for postmenopausal women with recurrent infections. Turning to pelvic floor structure, a prospective cohort study. The investigators found that the levator hiatus area increased from mid-pregnancy to 8 years in participants with at least one vaginal delivery, whereas those who delivered exclusively by cesarean section showed a decrease in hiatus area. Interestingly, subsequent vaginal delivery after an initial vaginal delivery did not affect the hiatus area measured during Valsalva maneuver, highlighting how first delivery mode permanently reshapes pelvic floor dimensions. In gynecologic oncology and uterine surgery, several studies examine post-procedural outcomes and novel diagnostic strategies. A large database study published in Obstetrics and Gynecology compared long-term rates of repeat procedures after excisional treatments for high-grade cervical intraepithelial neoplasia using cold knife conization versus loop electrosurgical excision procedures. Loop electrosurgical excision was associated with higher cumulative rates of repeat diagnostic evaluations and repeat excisions, whereas cold knife conization carried higher rates of subsequent hysterectomy and a 1.2% diagnosis of cervical cancer by 36 months, compared with 0.7% after loop electrosurgical excision. Meanwhile, looking at surgical complications, a multi-center randomized trial published in Fertility and Sterility evaluated an in situ forming intrauterine hydrogel barrier to prevent intrauterine adhesions after adhesiogenic hysteroscopic surgery. In intention-to-treat analysis, a greater proportion of hydrogel-treated participants were adhesion-free at second-look hysteroscopy compared with controls, with the benefit concentrated primarily in patients undergoing adhesiolysis rather than myomectomy. Advancing toward non-invasive diagnostics, a multi-center prospective study in the American Journal of Obstetrics and Gynecology investigated whether a 100-gene circulating cell-free RNA plasma signature could differentiate uterine leiomyoma from leiomyosarcoma. The machine learning classifier achieved an area under the receiver operating characteristic curve of 0.868, demonstrating promising potential for preoperative risk stratification once validated prospectively. Finally, addressing a rare but severe complication, a systematic review and meta-analysis in ultrasound in obstetrics and gynecology evaluated cesarean scar pregnancies continuing into mid to late gestation. The pooled incidences of placenta accreta spectrum disorders and hysterectomy were remarkably high at 0.90 and 0.39, respectively, with type 3 and exogenous subtypes carrying the highest risks of invasive disease and poor term delivery outcomes. Transitioning to reproductive endocrinology, menopause management, and pregnancy care, recent findings highlight both therapeutic nuances and real-world patterns. A secondary analysis of randomized trials. Randomization to oral hormone therapy did not increase coronary heart disease risk in patients with treated hyperlipidemia or favorable baseline lipid profiles, but risks more than doubled among participants with untreated, severely elevated low-density lipoprotein cholesterol. Complementing this, a real-world database study also 0.000 menopausal women, finding that roughly 1/5 initiated therapy within a year of diagnosis, predominantly with estrogen-progestogen formulations. However, persistence was low, with only 38.8% continuing at 12 months, and significant racial disparity showed faster discontinuation among Black and Hispanic patients. In thyroid care, A secondary analysis in Obstetrics and Gynecology followed untreated pregnant women with early subclinical hypothyroidism or hypothyroxanemia, demonstrating that roughly 88% of those with subclinical hypothyroidism and 61% with hypothyroxanemia experienced spontaneous normalization of thyroid function during pregnancy, suggesting early screening may capture transient fluctuations. Finally, looking at physician well-being, a longitudinal study in the American Journal of Obstetrics and Gynecology evaluated over 1,600 first-year obstetrics and gynecology residents, revealing that 35.6% screened positive for depression during their internship, yet fewer than one-third sought mental health treatment, underscoring an urgent need for structural and accessible mental health interventions in the specialty. If you only have time for one paper this week, make it the TAPER trial on vaginal estrogen application techniques for recurrent urinary tract infections. This study provides practicing clinicians with a simple, evidence-backed strategy, periurethral application, that achieves equal infection-free rates to intravaginal application while drastically reducing local adverse effects like vaginal itching. Here are the key takeaways from this week in Obstetrics and Gynecology. Periurethral estrogen application is non-inferior to intravaginal application for recurrent urinary tract infections and significantly reduces vaginal itching. Cold knife conization for high-grade cervical dysplasia is associated with lower rates of repeat excision, but higher subsequent rates of hysterectomy and cervical cancer compared with loop electrosurgical excision. Baseline low-density lipoprotein cholesterol levels modify the cardiovascular risk of oral menopausal hormone therapy, with elevated untreated levels doubling coronary heart disease risk. An intrauterine hydrogel barrier significantly reduces adhesion formation following hysteroscopic adhesiolysis. Over one-third of first-year obstetrics and gynecology residents screen positive for depression during internship, yet treatment seeking remains critically low. That's your roundup for this week in Obstetrics and Gynecology. The full transcript and references are available on the episode page in your Audio Scholar library. This is an AI-curated summary. For clinical decisions, always consult primary sources and current guidelines. See you next week. If this weekly briefing is useful, follow the show in your podcast app so new episodes arrive automatically. And for audio briefings on your own clinical questions and papers, visit audioscholar.cc. This is an automated summary generated by artificial intelligence, which can make mistakes. Always review the original source materials.